Lower back pain, as you just mentioned, is probably the most prevalent and standard fear or niggle that people have to deal with in the modern world. So if you could give anyone listening a few things to consider when it comes to managing their back pain, that I'm sure you develop in much more detail in the book, of course,
Yep.
what would you tell them?
I think it's trying to establish what their pain is. So it's very important to find out what makes it worse, what makes it better. So I think understanding how your spine works, how the tissues around the spine works. So that the normal thing, if you're getting a sharp pain going down your leg, can be a possibility that it's affecting your nerve. If you've got an ache and it's just a general ache there and it gets better with putting heat on, it's probably a muscle. If you've got pain, if you're bending down and you get a sharp pain and you've got pain going down your leg, it's probably a disc in between your vertebrae. If you've got pain and you're twisting and you're leaning backwards, it's probably a joint, you know. So there's different types of things which I talk about in a book, and I make it as simple as possible. But I think try and move, and if it hurts, jot it down and go and speak to a practitioner or somebody that can give you the best advice. But as I said, there's loads of tools out there now, so you can use your own hands and rub an area and try and test it. So it's kind of like a trial and error in a safe zone, which many people do not do. Many people just think, oh no, I'm in pain, I'm just going to sit down here. Or they just ignore it and do the same action, and that causes pain. So I think knowledge is the best thing, and that's what I try to explain in my book. And then kind of thinking of things that you can do as a self-management and when you need to like find the help. So it's finding out if things are a red flag. And one of the red flags, if it's a constant pain and painkillers are not working, and it's just getting worse and worse, you need help, you know. If you've got lower back pain and you're getting pain down your legs, in both legs, you lose the ability to go to the toilet. So a change in your bowel habits, pain when you're going to have a number one, weeing, that's a red flag. So definitely get that seen to.
I think the tendency is it's not to get complacent. I think time is the most valuable tool when it comes to short-term injury management and recovery.
Yeah.
The way I always try and look at things is if time doesn't fix it, you probably need to see somebody, or you probably need to better understand what is causing it. I think back to my mum, who the amount of times that she's done her back gardening.
Oh boy.
And then can't really do anything for a couple of days. Time will sort of improve it. But then again, we've had the discussion on, well, look, if this keeps happening, then there's probably some sort of mobility related issue that could be adhered to better by doing X, Y, and Z. But then the actual actionable next steps to be able to implement that and do that consistently over time to therefore try and prevent gardening being the thing that causes her issue in her back, that's the hard bit. And I think that's where people really struggle in the modern world because we're all so busy and there's so many things going on.
But the thing is, that's one of the main hobbies that triggers back pain. And it's that analogy again, we have to see ourselves as athletes. So it might sound funny saying it, but we need to warm up before we do the gardening. Because when you think about it, you're bending down, you're twisting in a weird way, and you're there for a long time. And most people don't have breaks. So just going back to that Formula One car, you need to have a break, stretch out, and then get back to it. And I always say to patients and my mom, I always say, try and get people to do the main bit of the garden if you can, or get help to like do it. And then you just do the little things, or kind of think that you don't need to do hours and hours in a day. Break it down. Have those breaks, stretch out, you know, or just like an athlete or someone doing a marathon, try and get a massage just before doing the try and get a massage just before doing the gardening. Instead of just going without doing no prep work and doing a task that's just going to put so much force or pressure on your body.